I'm Celeste Chandler, and this is the I Am VETS Community News Podcast. If you're listening to us on Spotify, iTunes, or iHeartRadio, make sure you follow us and download it. Also, follow us on YouTube at the I Am VETS Community News Podcast channel. Don't forget to like, subscribe, and also press the notification bell so that you can be notified each time we have a new podcast. Today, we have a very special guest. His name is Dr. Cain. How are you doing, Dr. Cain?
How are you doing, Celeste?
So tell us, where do you work and what do you do?
I work for the Cain Community Clinic here in Jacksonville, North Carolina, and I'm also a telemedicine doc. I work for American Well.
And I understand you're a veteran as well.
Yes, I was in the Navy and I retired from the Air Force.
Awesome. Let's talk about viruses. So how many people in Onslow County have been vaccinated for the COVID-19 virus?
68% of the total population in Onslow County have been vaccinated for the COVID virus.
Also, can you tell us about how many people in the North Carolina area and the United States have been vaccinated?
In North Carolina, 78% of the population has been vaccinated, and 68% of the United States has been vaccinated.
Okay. So 68% of the entire population of America has been vaccinated.
Yes.
68%. Awesome. So, what are your suggestions on how to stop the spread of COVID-19?
I would suggest vaccination first, and also isolating yourself when you're ill, away from other people. It still might be wise to wear a mask, especially if you aren't feeling well. Those things, hand washing, of course, would also be something that I would recommend.
Okay, great. All right. So, of course, hand washing is important for everything, but especially in these days and times, we have also many viruses out there.
Yes.
So, what are your suggestions about? I apologize. What are the death rates as it relates to COVID-19 now?
In terms of death rates, what you need to look at is people that are vaccinated and people that aren't vaccinated.
Okay.
I have studies here. If you look at a population, this was a study done in Mississippi, where in terms of actual infections, 97% of the people who were infected with COVID were not vaccinated. 88% of hospitalized patients were not vaccinated for COVID, whereas 12% were. And in terms of deaths, 86% of the deaths were in people that were not vaccinated, as opposed to 14%. So vaccination plays a very important role in preventing hospitalization and deaths from COVID-19.
Great. That's great information. So, we know that that COVID-19 is a very deadly disease, but who's most at risk?
The elderly are the most at risk for COVID-19, and people that are immunocompromised, people that have certain diseases. 81% of the deaths from COVID-19 occur in people 65 and older. People with asthma and other respiratory tract type diseases like COPD are at risk for COVID-19.
Okay. So I guess our elderly people should be more cautious and protect themselves and make sure that they're vaccinated.
Definitely, the elderly should vaccinate themselves, and you need to take other sort of smart healthcare measures if you have an elderly parent or grandparent and you aren't well, you probably shouldn't visit that person. Just common sense things like that.
Okay. All right. Well, you know, a lot of people out there, you said 68% of the U.S. has been vaccinated. So, what um, what do you say to persuade a person who hasn't been vaccinated to get vaccinated?
All you can do is explain to the person the advantages of getting vaccinated. That's essentially all you can do. I think people pretty much made up their minds whether or not they're going to get vaccinated. There's a lot of resistance to vaccines, and I've spent a lot of times trying to convince people to get vaccinated and haven't been very successful at it. So,
Okay.
so
Well, maybe this will help. This will help, doctor.
So that's, my point is that if you have some underlying illness, you have asthma, you have chronic obstructive pulmonary disease, or you are 65 or older, you definitely should consider getting vaccinated.
All right. Well, there's the other stuff out there right now. Things like monkeypox. First, let's cover the new strands of COVID-19, the COVID virus.
Well, I mean, it's the Omicron strand that we're looking at now. The new one is the BA.5, is the one out there now. These mutations occur quite frequently with COVID. One thing to look at with mutations is that the vaccine that you have now may not may not prevent you from getting COVID-19 because of these mutations. But the vaccine will keep you out of the hospital and will keep you from dying from the virus.
Okay. So are there any new symptoms that come along with these new strands?
What I've seen, and I think a lot of other people have seen too, is that now you see people with severe sore throats, headaches, complaining of symptoms that you might think they have sinusitis, and you don't see the loss of taste and loss of smell that we saw with the earlier virus.
Okay. Okay, polio is out there too. Did they relax the polio vaccines?
No, polio essentially has been eradicated from the United States, and it was a lot of good public health work that got rid of polio. This was a very bad disease. It still is a bad disease. Every mother feared for their child when polio was out in the community. Polio is a virus that's transmitted by fecal-oral transmission. It's called an enteric virus because it affects the intestinal tract. It gets into the intestinal tract, sets up an infection, moves to the blood, and most people may have flu-like kind of symptoms of muscle aches, fever, chills, some diarrhea, and then about 10 days it goes away. But some people it affects the brain and affects the nerves that are responsible for movement, and then it can cause weakness that might be reversible or actually cause paralysis that may be permanent. But to answer your question as to has the vaccine been relaxed for polio, that's not what's happening with this polio virus. The vaccine for polio, the first one that came out, was an inactive virus, and it was given by injection.
Okay.
And that produced immunity in the blood, but not in the gut. A few years later, a vaccine came out that was an oral vaccine, but it actually was a weakened virus. And that vaccine produced immunity in both the gut and the blood.
Okay.
So this vaccine was designed, the virus was weakened so that it would not cause paralysis. And people would get the vaccine, they would pass it out in the feces, and then again, people would get reinfected from that infected stool with polio, and they would get immunity from the vaccine. But eventually that vaccine mutated, or that virus mutated, and it caused a viral-induced polio and actually caused paralysis. Now, I'm saying that to say this. The one case of polio that we saw in New York a few months back happened in an individual that was not vaccinated, and unfortunately the person became paralyzed from polio. But this was the vaccine induced polio. It was from the virus that was given to cause immunity, and that's what caused polio in that person. In the United States, we stopped using the oral vaccine because there was more people getting polio from the vaccine than actually from the natural virus.
Okay.
So the bottom line of all this, all I've said about polio is that if you're vaccinated, you don't have to worry about polio.
Okay, great. That's awesome. Okay, so monkeypox. If monkeypox originated in Africa, why do we see cases here?
You're right. Monkeypox originated in the Congo, and it was isolated from monkeys, and that's why you get the name monkeypox. But monkeypox can be found in other animals like rodents. We are seeing monkeypox in places that we don't usually see it, in the UK and the United States, and these infections are in these countries are seen in 95% of men that have sex with men. Monkeypox, though, should not be considered a gay disease.
Right.
You don't want to call it that, because anyone can get monkeypox.
Okay.
It's transmitted by close contact, or you can come in contact with infected bedding, clothing from someone else that has had monkeypox. So what we're seeing here in the United States is monkeypox from these parties that they have some a lot of incidents of monkeypox have been found in adult saunas in bathhouses.
Okay.
So that's what we're seeing in the United States with monkeypox.
What are the symptoms of monkeypox?
You get a skin lesion, which is actually called a pox. So it can be a little pustular lesion on the skin, an elevated lesion on the skin, and you can have other symptoms like muscle aches, chills, those kind of symptoms. But it's unusual here in the United States. Traditionally, when you see monkeypox, you see a lot of rash, see a lot of pox on people. But sometimes there may just be one lesion in the genitals, anus, or in the mouth that you may see with this particular virus as it presents here in this country.
Okay. Well, where does a person go if they suspect they have monkeypox or the COVID?
Well, two things you should do. If you suspect you have monkeypox, the recommendation is to just get the vaccine, and that offers some protections against monkeypox. So you need to call your primary care doctor, your physician, or go to the health department if you have the risk factors for monkeypox, have been exposed. to monkeypox. So that would be the recommendation there. If you have COVID-19, call your provider. There are drugs out that we can give you now for COVID-19. If you fall into a category that would be eligible to get that drug, that would be 65 years or older, or have some risk factor like asthma, COPD, diabetes, or obesity.
Okay.
Any of those would qualify you for the drug.
Okay, well, give any final remarks, Doctor?
There's several diseases that are out in our community, and the best thing we can do to protect ourselves from these diseases is to get vaccinated. There are vaccines available for all three of the diseases that we discussed, monkeypox, polio, and COVID-19, and you can contact your health department about the vaccines.
All right, well, thank you so much, Dr. Cain, for coming here and sharing all of this information with us about COVID and monkeypox and polio. Thank you so much. And this wraps up this episode of I Am VETS Community News Podcast with Dr. Cain. Thank y'all for tuning in. Don't forget to follow us, download